Good morning. It's my pleasure to join you today and to share some thoughts on how we at Shoppers Drug Mart view the current changes to pharmacy scope of practice, and as well how we can partner together to improve patient outcomes. I'm a pharmacist by training, and I've done pharmacy in both retail and hospital settings. And in addition to that, I've spent 15 years in the pharmaceutical industry in marketing, sales, as well as medical. So I hope I can speak for us all in saying that we're entering a time of unprecedented changes and pressure on the healthcare system. Why is the profession of pharmacy evolving? On one hand, we have healthcare costs that are rising and provinces that are struggling to keep up with that. So we've seen a lot of pricing reform over the past couple of years, and this is really challenging for community pharmacy. But on the flip side, and more positive side, this has led to enhanced scope of practice for pharmacists. And it positions the pharmacist as part of the solution to help bring down healthcare costs and also to provide patient-centered services that we've all been trained to provide. The next slide shows a picture across Canada of all the different enhanced scope of practices that are sanctioned by the different provinces. And as I submitted my slides, I was told that PEI also was added to the picture in terms of reimbursement of health medication reviews. So this picture is changing frequently. If we looked 1 year ago, a lot of the boxes would be empty. So now pharmacists in different provinces can either renew prescriptions, adapt prescriptions, or in some cases, even prescribe prescription medications. And this is in minor ailments such as in GERD, or allergic rhinitis, or migraines. And we see this list as growing. So I know what you're all thinking. Just because pharmacists can do it, doesn't mean they're actually doing it. Well, at Shoppers, I can share that our patient care services claims actually doubled last year versus a year ago. So I know that pharmacists are excited and are engaged in expanding the scope of practice and in really providing that frontline patient care. So from a patient-focused program standpoint, how does enhanced scope of practice really fit into that healthcare puzzle we see at the bottom? Well, a lot of government reports emphasize the role that pharmacists play in providing frontline healthcare. We know that patients see pharmacists 5 times more than they see their doctors. At Shoppers Drug Mart, we dispense over 100 million scripts a year. And it's because we see patients that many times more that we're in a position to give truly integrated and comprehensive solutions to them. So you see the patient journey at the bottom of the slide. So pharmacists touch patients, whether it's in prevention and screening, to treatment and optimization, as well as adherence and monitoring. So we talked about the different touch points along a patient's journey, and a pharmacist is there at all the different touch points. As well, the OPA and BCPA also documented studies where showing that pharmacists can actually decrease the cost to the healthcare system as they engage in expanded scope of practice. So the next question I have is, how do we work together? How do we partnership to make sure that we have patient-centered programs that are improving outcomes? And I've listed some examples of expanded scope programs as well as disease management pharmacy programs that we've partnered with companies and associations on. Under expanded scope, an example of this is our injection programs. So we've partnered with a flu vaccination company, and we grew the number of flu vaccinations in our pharmacies by 145% last year. In terms of travel and preventative vaccines, our pharmacists are helping to screen and recommend therapies. And provinces where pharmacists can do injections, they are training patients to give injections, and this has implications and opportunities for biologics as well as diabetes therapies. On the right side, under disease management, these are the programs that are the comprehensive patient programs that we've been talking about that incorporate expanded scope, patient education and end with the patient call to action, whether it's through lifestyle management or going back and having that dialogue with their doctor. And I'll highlight 3 different examples of these programs in the following slides. Under diabetes, we know that about 2.7 million Canadians live with diabetes. We also know that 1 million Canadians don't even know they have diabetes. So we partnered with Public Health Agency of Canada to actually do some screening for those high-risk patients, to help patients to get on that patient journey. At our stores, we also have A1C clinics. So if patients are on diabetes medications, they think they're doing well. How well are they actually doing? We found that 50% of them were managed suboptimally. So here's a great segue to talk to the patients and to also involve physicians in that conversation and make sure that we monitor patients throughout their journey. We also offer in-store campaigns. Right now we have a diabetes head-to-toe campaign that really teaches patients about managing their diabetes beyond just blood glucose testing. It's about managing the retinopathy, managing their foot care, the whole patient, the entire patient, and managing diabetes as an entire disease. And we also collaborate with Great West Life to bring programs to their plan members. And we developed a special program that is a diabetes management program where they get one-on-one consultations for their plan members with Shoppers Drug Mart pharmacists. And here we also partner with the diabetes company to offer educational material to those patients as well. Under heart health, we've all seen patients come in and take their blood pressure readings at various pharmacies, but at Shoppers Drug Mart, our pharmacy does 12 million readings annually. And think about the number of times those patients come in and see the pharmacist, and about the opportunities, whether it's cross-product promotion or advertising while they're waiting in the pharmacy section. We also collaborated with McGill University to launch an online heart age calculator. And basically, this is a calculator that shows what your heart age is compared to your actual age. And it was a real wake-up call for the patients. We had over 85,000 patients go online and complete the assessment, and about 1/3 of them had a higher heart age than a chronological age. Many of them didn't know their blood pressure. Almost 90% of them didn't know their cholesterol levels. So a huge opportunity to educate. And the next slide just shows what the heart age calculator actually looks like online. And in this particular patient, they were 46 years of age, but their heart age was actually at 61. So on the right is the call to action and the types of things that they can do to help manage their heart age, to decrease it and to decrease the risk. And again, these partnerships offer us ways to engage the patient and to connect with them beyond just the product. And last but not least, adherence. We know that about 50% of patients stop taking their medications after 6 months to a year. And whatever we can do to improve adherence can improve patient outcomes, but also I think can improve both our businesses. So here's a prime opportunity to partnership. We've done callback programs really targeting non-adherent patients, and that's where we see a big ROI because it's really a targeted effort there. We also have done force print programs to promote education and to offer website enrollment information that manufacturers provide support to patients with. We also have mailers that are sent to our patients at different key renewal times. And as a result, we've seen about a 15 to 50% increase in adherence in our short-term programs and up to 90% plus adherence in our longer-term programs. So imagine if that 50% of patients at the end of 1 year turned into 70, 80, or 90% of patients. What would that mean for that patient's health as well as for both their businesses? So I've talked about how pharmacists can become part of the solution to the healthcare puzzle. Let me talk a little bit about how Shoppers Drug Mart can be a partner in that. At Shoppers, we are a network of over 1,300 pharmacies across Canada. We are national in scope, but we can adapt to local market needs through our associate model. And not only that, we believe in taking care of the whole patient. So while dispensing is still part of our core services, because we dispense over 100 million scripts a year, it's really the pharmacy programs and the enhanced scope of practice that help us build that connection and that engagement with our patients and keep bringing them back. And not only do we offer a retail presence, but we also have a specialty presence in our specialty health network. We have long-term care presence with our MediSystems pharmacies, and health solutions, which works with different payer groups to bring programs to plan members. So I hope I can say that I look forward to partnering with you in bringing patient-centered programs and improving patient outcomes. Thank you.